Hello everyone, my name's Emma and I'm a physical therapist here at Hand and Orthopedic Physical Therapy. Today I'm going to talk about low back pain, particularly disc injuries, and how you can help treat this at home. You may have heard of a herniated disc or a blown disc. This injury often happens with bending forward or twisting, especially if you're carrying or lifting something heavy. It can feel like a sharp pain in the back with radiating, burning, numbness, pins and needles, or tingling down into the leg. It can travel just into the buttocks or it can go all the way down to the toes. This pain is often worse in the morning and with sitting for prolonged periods or bending forward. In severe cases, you might even feel a weakness in your leg. The good news is that this is an injury that can heal on its own in many cases. It requires a little bit of physical therapy and specific exercises as well as time to heal itself. I'm going to be talking about some exercises today that you can do at home to help with this. In addition to these exercises, walking is going to be important to help you heal, especially in these initial phases of the injury when the pain is pretty severe. Start with short distances and then gradually work your way up to longer distances. The movement, as well as being upright and getting your heart rate up a little bit, is going to help you heal. In some cases, this might be a more severe injury if you have any of the following symptoms: changes in bowel or bladder function, changes in sensation around your buttocks or your genitals, or sudden difficulty walking or changes in balance. If you experience any of these, you should contact your physician because this might be a little bit more serious than a herniated disc. Let's go ahead and get started. Tilt your pelvis forward, then backward, forward and backward for 2 minutes, and then tip your pelvis to the right and to the left, hiking your hip up each side, also for 2 minutes. Rotate your knees to one side, hold for 15 seconds. Rotate your knees to the other side and hold for 15 seconds. Should feel a light stretch in the low back and no pain. Continue repeating right and left for about 5 minutes. Bring one knee into your chest, pulling gently with your hands. Hold for 15 seconds. Switch legs. Bring the other knee in and hold for 15 seconds. Complete this 5 times on each side. Cross one ankle over your knee and push your knee away from you. If you don't feel a stretch with this, reach through the crossed leg and pull your other leg towards your chest like this. You should feel a stretch back here. Hold for 30 seconds and then switch sides. Start by laying on your stomach with your neck in a neutral position like this. If this feels comfortable for you, press up onto your elbows like this and make sure your back muscles are nice and relaxed. Hold this position for 30 seconds to 2 minutes and then go ahead and lower back down. You can alternate this position for 5-10 minutes at a time. This exercise puts your back in a position where your disc has less pressure so that the bulge in your disc can start to heal. The goal of this exercise is for the symptoms or pain that's in your leg to travel up your leg and into your back. Even if you have increased pain in your back, as long as the leg is feeling better, that's a good thing. This is called centralization of your symptoms. If either or both of those positions are too uncomfortable for you to stay there, that's all right. It just might not be the right exercise for you right now. You can try them again tomorrow. For long axis traction, you'll need someone at home to help you. The person who's injured should lay flat on their back on the bed. This bench is a little bit lower than a bed would be, so I'm going to be kind of lowering myself down as the helper in order to do this. Helper is going to grab onto the ankle, just above the ankle bones. Make sure the person who's injured is nice and relaxed. And then helper is simply going to lean back so that they're pulling straight down on the leg. This should feel pretty good for the person who is injured and can often make the pain travel from the leg up into the back, which is what we're going for. Hold as long as the helper can tolerate. Helper should not have any pain in their back with this. Thanks for watching, everyone. I hope you enjoyed, and I hope it can be of some use to you. As always, please feel free to contact us if you have any questions.